You're about to see one of the first humans being injected with a potential COVID-19 vaccine. Only 2 clinics are working on this trial in the country, and one of them is right here in Missouri. I spoke to the doctor who's leading it.
Explain to people why this vaccine is safe for these people who are the patients in this trial.
Well, I think that this technology, as far as this is a little bit different than other vaccines, and it's used what's called a plasmid DNA, which everybody knows what DNA is, but it's a segment of DNA that is on the that they've duplicated that basically is part of the cell wall of the virus. And so when we inject those antigens into the arm intradermally, the immune system reacts to this foreign invader, develops antibodies against it. And of course, this is not a live vaccine. It's a killed, basically it's not even killed. It's produced as a duplication of the viral cell wall. But now we've primed the immune system to recognize this invader.
How do you observe them going forward now?
The number 2 thing that you said, basically that we keep them here for a period of time of observation to make sure they don't have some unanticipated, unusual response, which, you know, we do that with all the vaccines that we give when we're studying them. If they don't have that, then we go home and we follow them up with interval visits and also phone call visits. Anything that happens, if they stub their toe, we capture that as an adverse event. If they have a bloody nose, we capture that adverse event. If they grow a cow out of the side of their head, we capture that adverse event. And then I determine, as the principal investigator, whether I feel that's at all related.
At what point do you know that it works?
Well, what we do, we won't know it till it works until it's out being used, because we don't have a control group. We are not treating the disease. We are looking at antibody levels. Now, if we are looking at a drug, say for arthritis, we know it's working because we capture symptoms and physical findings and laboratory work that can see, oh, these people are really getting better. If we're testing a drug for cholesterol, well, we know it works because we see the cholesterol level come down. If we're testing a vaccine, primarily what we're looking at is we're not treating the disease, we're preventing the disease. So you can't really look at efficacy other than the antibody level that rises and stays up, that we know is protective. So it's a little bit different with a vaccine than it is with a drug where we're treating the condition that we can see improve. These are healthy volunteers. There's nothing there to watch to improve. We have just mainly the level of the antibody that we know is protective, or that we hope is protective.
Dr. Irvin says 40 patients will receive this vaccine across the 2 clinics. The other clinic is at the University of Pennsylvania in Philadelphia. I asked him, what do people get out of this as far as maybe some money or something, a stipend? He says they get about $100 per visit, and then also they're reimbursed for their travel expenses. And he says that's not any different than what people would be paid to participate in any trial. They're not upping the ante, so to speak, because this is a COVID-19 potential vaccine trial.
And normally, Dr. Irvin says it would take 8 years to get FDA approval for a vaccine like this, but the FDA is accelerating the process. He hopes, if it works, to have it approved in 1 year.